Welcome everybody, and thank you very much for giving up an evening. I'm very pleased that you've all made the time to be with us tonight and to hear some really inspiring stories about the massive impact of the polio campaign. And hand over to Judith, who I'm sure most, if not all of you, know very, very well. Judith is our National PolioPlus Advocacy Advisor. She's on the International PolioPlus Committee, and she is so many other things. And I won't take her time on introducing her. I would rather she shared to all of us how amazing the plus in PolioPlus actually is. So over to you, Judith, please.
Thank you, Jannine. Good evening, Rotarians. It really is a great pleasure to join you this evening, and thank you for coming. And what I'm going to do is to update you on the plus in PolioPlus. So I'm going to start with some brief background. This photo that you can see shows Jim Beaumont. He was president of Rotary in 1979, and he's administering polio vaccine to a little girl in the Philippines. And it was a vaccination that would change Rotary and the world's history. Before the program we now know as PolioPlus was formed, immunization projects were part of the Health, Hunger and Humanity program, the 3H program of Rotary. And Rotary leadership had undertaken some successful polio immunization grants and had met with both Jonas Salk and Albert Sabin. The two supported different approaches. Albert Sabin was in favor of mass immunization campaigns, and this was a relatively new concept. Of course, we're very familiar with it now because that's how we've been operating the program. Jonas Salk supported a more measured introduction through the expanded program on immunization. In the end, PolioPlus was a balance of these approaches intended to encourage, to the extent possible, Sabin-type mass polio immunization projects, at the same time strengthening WHO's expanded program of immunization and health for all by the year 2000. They were very optimistic. The expanded program on immunization focused on making immunization against diphtheria, pertussis, tetanus, polio, measles, and tuberculosis available to every child. Following the success of the initial polio immunization project in the Philippines, other 3H immunization projects were undertaken, including a project for measles in India. In January 1985, at a meeting with Dr. John Sever and Dr. Hector Acuna, WHO agreed to recognize Rotary and its polio 2005 3H project, because of course our aim was to complete eradication by 2005. But in the next month, on the advice of their public relations advisors, Rotary changed the name to PolioPlus to give it a standalone identity and to reflect that the polio program would inevitably do more than just eradicate polio. I'll also pay tribute to Dr. John Sever. He was there at that meeting when WHO negotiating on behalf of Rotary. He's a very eminent scientist, and I'm sure many of you will know him. He is still on the International PolioPlus Committee today, and he has attended every committee meeting bar one. He missed one last year because his wife was ill, but he's the most remarkable individual, and I feel very privileged to serve on that committee with him. In the early days of PolioPlus, there were a small number of grants that supported immunization activities in addition to polio. The fundraising goal for the PolioPlus campaign has been calculated based on the cost of oral polio vaccine, using the number of newborn children in developing countries. Polio vaccine was inexpensive, easier to administer, and thereby making it an ideal fit for Rotary Club involvement, both in terms of fundraising and active involvement in immunization campaigns. And with the eradication goals set in 1988, the focus of the PolioPlus really shifted to polio, with pluses being the activities such as supporting cold chain infrastructure, social mobilization, and advocacy that support polio immunization. We've come a very long way since those early days. And while our primary focus has been and continues to be on polio eradication, there are a number of pluses that you can see on the screen, and ways that this work is value added for broader public health efforts. Did you know that every year on average, the following added value interventions are delivered alongside the oral polio vaccine, the items you can see on your screen. Thousands of healthcare workers and community members have been trained as part of the polio surveillance and immunisation campaigns, and these staff have been pivotal in strengthening routine vaccination and in delivering new vaccines and other treatments during polio campaigns. Today, almost 90% of WHO immunisation staff in the African region are funded by the polio programme. 85% of them give half of their time to immunisation, surveillance, and outbreak response for other initiatives. And I attended the World Health Assembly in November and January, split over 2 meetings. And it recognised the great importance of the polio programme to the response to COVID, making this point that in many countries, especially in Africa, the polio infrastructure and health workers is the absolute total support for their health programs. Beyond vaccination and treatment handouts, polio personnel have used their expertise in preparedness and disease surveillance in other major outbreaks over the last 20 years, including recurrent outbreaks of plague in Madagascar, yellow fever outbreaks in Borno with 8 million being vaccinated, and the recent Ebola outbreaks in Nigeria and in the Democratic Republic of Congo. Polio workers prevented Ebola from spreading using the polio surveillance and contact tracing systems. Since 1998, the inclusion of 82 million vitamin A supplements during National Immunisation Days has averted an estimated 1.5 million childhood deaths. And measles has been another important plus in the polio programme. And as you can see on the slide, we've given more than 64 million doses of measles vaccines. And in 2018, just to show the impact of this, measles cases in India reduced by 43% using our polio infrastructure and health workers. Children protected from polio still face other illnesses. And in Borno, malaria kills more people than all other diseases combined. To prevent its spread, insecticide-treated bed nets are often distributed for free during the polio immunisation events. And in 2017, the World Health Organization organised a campaign to deliver anti-malarial medicines to children in Borno using polio eradication staff and infrastructure. And this was the first time that anti-malarial medicines were delivered on a large scale alongside the polio vaccine, and the effort reached 1.2 million children. Rotary and its partners also distribute soap and organise health camps to treat other conditions. The pluses vary from one area to another. Depending on the environment and what is seen as the need, we always try to bridge the gap. As the world gets closer to zero polio cases, it's increasingly important to track the virus to its final hiding places. The polio programme's active global surveillance system ensures a targeted, real-time response to any sign of polio anywhere in the world, minimising the risks and consequences of additional spread. This intricate network, as you can see the spread of it on the map, to detect cases of polio paralysis is constantly expanding and is unique in scale and capability. The system also collects and analyses positive samples in the environment, isolating the virus before it's able to reach and paralyze children. Each year, some 100,000 samples from acute flaccid paralysis patients, as well as large numbers of sewage and water samples, are processed in 146 laboratories in 92 countries across the 6 WHO regions around the world to detect the polio virus. And the information gained from this surveillance informs the mobilization of program resources and vaccination campaigns. And it has allowed the polio program to certify with complete certainty the eradication of 2 strains of the wild poliovirus, wild poliovirus 2 and wild poliovirus 3. These laboratories also provide benefits beyond polio eradication, detecting currently and responding to COVID-19 and other public health threats, including measles outbreaks, yellow fever, neonatal tetanus, and avian influenza. Emergency operations centres provide a central location from which to coordinate data collection and response to a public health threat. They've been a really important innovation in the programme in the last 10 years. They allow staff from different offices, sectors and organisations to work directly and collaboratively to share information in real time and formulate a joint plan of action. And EOC leaders have a direct line of communication with government officials, allowing for more immediate access to needed staffing and funding. And with these advantages, the emergency operations centres generate quicker, better synchronised and more effective emergency responses. And these centres have been established in Nigeria, Pakistan and Afghanistan. And they've played a key role in responding and coordinating to the outbreaks of Ebola and, of course, in the last 12 months also to COVID. They help immensely in tracking in real time both disease outbreaks and the resources being put towards them. And data collected from the field is transmitted to a central location, and the actions of local responders are closely watched, providing direct accountability for vaccinations and surveillance, and ensuring that the funding flows go to where they're supposed to go. A very important part of the programme has been empowering women. Female vaccinators are crucial to building community trust and reaching all children, especially in communities where cultural norms prevent men from entering households. Today, female frontline health workers make up 87.5% of vaccinators in Nigeria, 63% in Pakistan, and 40% in Afghanistan. The GPI's focus on gender extends to female representation across all ranks of the programme, with a commitment to reaching gender equality in the technical advisory groups, the panels, the governance and oversight bodies. And in addition, gender-conscious efforts have helped to ensure the polio vaccine remains a truly equitable health service. Data from recent years show that girls and boys in polio-endemic countries are receiving equal protection from the virus. WHO and the GB&I have also developed a gender equality policy document, and it really is a model of its kind. And we've asked various ministers around the world if there'll be ambassadors. And Minister Wendy Morgan from Foreign and Commonwealth and Development Office, who's responsible for polio, she signed up to being a gender equality ambassador on World Polio Day last year, as did several other ministers from other countries. A range of broader projects have been undertaken as a result of Rotary's engagement in PolioPlus. And in some cases, this has happened organically, as Rotarians have travelled to participate in polio immunisation campaigns and have then seen other unmet needs, which have resulted in further projects. More recently, efforts have been targeted to reach high-risk communities, communities which have been harder to reach or more resistant to vaccination, or communities which have become resistant because other needs are not being met. In Pakistan, Rotary has established resource centres and permanent transit posts, which help to address broader health needs. I was in Pakistan on an advocacy visit in 2016, and we went up to the Fatah region, you can see in the northwest here on the map. And we were there to open one of these new resource centres. And the women health workers there were absolutely delighted, because these centres provide health advice, vaccines for all sorts of health. It's all sorts of health interventions, not just polio. And also another very important factor is water and sanitation projects, which you can see on the top right on the slide, because these address a critical need of communities and they foster improved hygiene, which helps reduce the spread of polio. And again, when I was in Pakistan, we visited a school in Lakshira, again in the Fatah region, and they were installing water into the school. They install them into schools and into village communities. And most of these are funded by Coca-Cola. We have a sponsorship agreement with Coca-Cola, and it's a wonderful, wonderful project, and it's completely life-changing for these villages. Also, our national PolioPlus committees in countries, they offer pluses. which have included desirable items such as soap, safety kits, and of course, in the last 12 months, personal protection equipment. And these value-added incentives play a key role in reaching every last child. I'll just mention about the PPE. One of the other roles I have is chairing the grants subcommittee for the International Polio Committee, which allocates the $50 million that Rotary raises every year and the $100 million that the Gates Foundation give us in matching funds. And we had a round of grant proposals we reviewed in January. And one of the grants that came in from UNICEF was very noticeable. It was for just under $1 million for PPE equipment for health visitors in Pakistan. Building trust and confidence is absolutely vital if we're going to get to the end of the road. And to build trust in vaccines among parents and caregivers and combat misinformation, Rotary and the polio programme is engaging with local politicians and influencers, religious leaders, and educators, healthcare institutions and providers, tribal elders and the media. These community-tailored approaches are playing a critical role in increasing confidence in the polio vaccine and also in immunisation broadly, and it's going to be very important in confidence for the COVID vaccinations. We've seen all the terrible situation in Europe in the last week with fears about the vaccine and the anti-vaccine lobby growing. The polio programme is also collaborating with social media platforms like Twitter and Facebook, especially in Pakistan, to curtail the spread of false and misleading information online and communicate positive messaging around vaccines generally. Furthermore, the government of Pakistan has launched an initiative dedicated to combating polio misinformation and increasing vaccine acceptance, including a WhatsApp hotline where people can call with questions and concerns regarding the polio vaccine and the national programme. And it's now being used for COVID, and they're getting as many as 70,000 calls a day. It's quite remarkable. So we continue to improve and refine our ability to reach every last child. And this includes children who may be displaced by conflict or natural disaster, who are part of nomadic communities or seasonal migration for employment, or simply living in relatively remote and isolated locations. The photo on the left shows a permanent transit post established by Rotary in Pakistan, which reaches children who are travelling along known routes between Pakistan and Afghanistan. And there can be as many as 50,000 in a day moving across these borders. It's quite extraordinary. The photo on the right shows a geographic information system, a satellite image. And such satellite images have been increasingly used to help map previously unmapped communities, making it easier for health workers to develop detailed microplans to ensure all families are reached during house-to-house campaigns, not only for polio, but for all health interventions. And of course, this last year with the COVID pandemic, that has seen a massive plus in the PolioPlus programme. The pandemic offers the latest example of the continued added value by our polio eradication efforts. And you can see the quote from the Independent Monitoring Board, how grateful they are that they have the polio programme that's been able to respond to COVID. The polio programme has one of the largest global public health footprints, polio health worker and infrastructure. And they're often the first responders to public health outbreaks like Ebola and even natural disasters. And of course, COVID was no exception. While polio immunisation campaigns were temporarily paused to ensure the safety of health workers and families, polio workers didn't sit idly by, but went to work to assist with the pandemic response. And it's noteworthy that a quarter of WHO polio staff are dedicating more than 80% of their time towards COVID-19 efforts. So how are polio workers fighting COVID-19? Well, you can see on the slide the various ways that we're doing it. The slide highlights the broad categories of the work. Frontline health workers are teaching communities how to keep safe from COVID. Surveillance medical officers are investigating cases of polio and COVID, and they're providing training for frontline healthcare workers. And just as they do for polio, when a person tests positive for COVID, their close contacts are also tested to determine if the virus is spreading, just like we have the contact tracing here in the UK. And this really is a demonstrable example of the plus in PolioPlus. So a few more examples. polio personnel trained laboratory staff around the world with regard to COVID. Community meetings that used to be held in person, where polio personnel conducted educational sessions on topics including breastfeeding, hand washing, and the importance of immunization. These were all transitioned to virtual and phone-based platforms. WHO polio personnel have joined country teams at all levels as incident managers, program coordinators, and data analysts for COVID. And they've added, the polio personnel have added COVID-19 systems to the list of disease symptoms that they're now tracking. And across the world, COVID-19 samples have been shipped to the polio laboratories that you saw on the previous map. The emergency operation centres and other resources have been used to track clusters of COVID-19 and conduct contact tracing. We've also conducted numerous training sessions using WhatsApp and other platforms to educate workers about COVID-19 prevention and symptoms. And polio communication networks, including local leaders, mosques, public address systems, are all being used to disseminate public health messages related to COVID-19. Governments across the world are relying on polio expertise and the reach of polio teams to fill gaps in public health services to respond to the COVID pandemic. And trusted community engagement teams are providing information on infection prevention and control, as well as mitigating anti-vaccine messages. And of course, we're providing large quantities of PPE. What are the lessons learned from all of this? Well, we've had to overcome so many hurdles, and we're not there yet. The eradication of polio will be an incredible achievement. And the lessons we've learned, lessons which are already being used to inform other challenges we face as a global community, will also stand as an incredible legacy and lasting plus of our PolioPlus programme. I've tried to highlight tonight a few of the pluses. I'll just summarise. So essentially, building trust in communities, innovating to identify and reach children, developing technology tools such as GPS mapping, developing new ways to ensure that work is data-driven. We hear that all the time in the UK from the government. Everything is based on the data with regard to COVID. Mobile data and near real-time monitoring and campaign evaluation, the engagement of women health workers, reaching vulnerable populations, and addressing broader community needs. We can take great pride in this plus and in knowing that every dollar we raise, every letter we write to a member of parliament, every time we share information with our friends and families about our efforts, we get closer to eradication and the added benefits that it offers. Thank you for all you continue to do to ensure that we will end polio. Thank you very much.
Thank you very much, Judith. And there will be an opportunity for questions through the chat box. But what I'd like to do now is just to move on to a couple of other aspects about the plus in PolioPlus, because a lot of what Judith has said is about trust. And for me, one of the most powerful things that every one of us can do as a Rotarian is use the trust that we as Rotarians, as individuals, as clubs, as groups, as an organisation globally, is to use the trust that we have developed at every level, whether that's with our own local community here, whether it's when you're doing work in projects, whether it's directly related to polio, whether it's through advocacy, whether it's staying in touch with your local politicians, whatever. We are trusted. So we have got a real voice, but we're not necessarily using it to the full extent. And I hope that, you know, the talk this evening, where it illustrates the vast impact of polio beyond just polio, gives you more tools to talk. I mean, many of you may be volunteering at the moment in relation to COVID vaccinations. Use that opportunity to talk to the fellow volunteers about Rotary's polio story, about the impact of polio on COVID and on so many other things. Get them engaged, use your voice. But for me, it's about personal stories. So reach out to people that you know are directly connected to polio in one way or another, or find stories that you can use. And for instance, there's one just been published in the last few days on the polioeradication.org website, which is the website for Global Polio Eradication Initiative, which obviously of which Rotary is a key partner in that. And this is a story about Hira. And Hira is a female polio worker in Afghanistan. And it sets out what she does and why she does it and how important it is. And it's not just about the work that she's doing for polio, it's in her role for polio. She's doing so much more. So reach out for those personal stories, because they're the ones that connect you. I know there are members of the meeting this evening who have been out on immunisation days. They've got personal stories to tell. Polio survivors in your Rotary Club or in your area, they've got stories to tell. And right now, with the power of Zoom and other online meetings, we can reach out to every corner of the world. And don't forget that just because we live in the relatively sheltered environment of Great Britain and Ireland, actually, when there is international travel back to some form of normality, when we are back to that normality, there is a lot of travel that goes on. There's a lot of members of other countries who have got families that have moved here or are working here or are studying here. And your voice on advocacy and the importance of vaccination and so much more is really, really important. And this is a slide that I've pinched off the internet from another Rotary district. And for me, it sums it up. You know, it's about everything that we do in Rotary. All of our service is linked to polio in some way or another. And I just want to quickly go through a few personal stories that are relevant to me and to Paul, my husband, who is sitting and hiding in the corner, and things that we've done or things that Rotarians that we're in connection with have been doing. So on this slide, you will see a building that is being reconstructed, and that's in Nigeria, and that's being reconstructed by Rotarians to help with the powerful messaging around literacy, around the importance of vaccinations, around the importance of healthcare. And the picture at the bottom is actually that room with the systems set up. But not only was it about making the building right, providing the resources for it again, but also it's in relation to the training that they then provided to 20 teachers from 20 different primary and secondary schools about e-learning, and taking the opportunity to explain the importance of vaccinations and about the importance of polio in particular in their schools. These two young people here are polio survivors that we met in Delhi. They were actually, well, the girl is now a teacher. The gentleman works for the maintenance side of things at the school. They are polio survivors who the school got to find out about when they were very young. They had no future. They literally crawled on the ground. Through that school and through some Rotary support, foundation grants and other support as well from other charitable organisations, they had an education. They are now very successful people. The girl is actually a teacher, special needs teacher. It's a school for a mix of people that have no different abilities and a mix of people that have lots of other abilities. It was originally mainly polio survivors, but now, because of where we're at with India, and thanks to Rotary and globally and to our Rotarians in India, the amazing work that's been done there, 10 years since India's polio free, it's about educating them, giving them those opportunities. Here, this is the picture from a beautiful young lady in the polio ward in Delhi. There is so much that Rotarians are doing through polio to improve the life of polio survivors as well. So as I said before, don't forget to reach out to polio survivors in your area. And I know that there's two here that have just sent me a message in the private chat asking that I mention them. It's Jill Russell and Cordo from the Winchester Rotary Club. They are both polio survivors and they'd love to talk to you. And there are many others. And don't forget Colin Powell. But a lot of the times that we're trying to get people to come and get their polio immunisations, It's not just about polio, which, as Judith has explained. So health camps are a terrific way of getting other people to come along for other reasons, such as these. It was glasses that were being provided, eye tests and glasses when we were taking part in one immunisation day. And these are pictures of a health camp in Pakistan. Water and sanitation is so important, and hygiene. And I have to say, my own experience of the hygiene from the people that we met in India on every visit was that their standards of hygiene are huge. But for many, that's a sort of source of water and sanitation that they have got to live with. So this woman was cleaning her washing, and I have to say, how they get their whites, they get them whiter than I do in my machine at home with all of the products that I use. 5 minutes before she was cleaning her washing on the floor here, it was actually full of cow manure, because that's where the cows go overnight, but they'd been moved out. You know, actually Rotarians making this happen. This particular community here, when we first visited there in 2010, there were only 2 members of that community who spoke any English at all. Very, very little English. When we went back there 6 years later, almost the whole community spoke English to one extent or another. And a lot of that was as a direct result of Rotarians getting involved and providing the mechanisms for those people to have an education and to also provide water, sanitation and hygiene. Community and economic development, another of our areas of focus. This here is actually providing sewing machines and the training and the materials for young people to actually have a future, to have a career. Really, really important. And this actually is at a school where they were being taught about the sewing skills. And in fact, Rotary provided those funds for some of those machines and provided the training, but also for beauty treatments as well. So I'm actually getting a temporary henna tattoo, the only tattoo I'll ever have in my life. Maternal and child health, very, very important. You know, this is actually a picture from a Rotarian in Nigeria. And what they were doing was they were training midwives and health workers from 20 primary healthcare facilities. They were giving them an understanding of the importance of polio immunizations, but of immunizations generally, you know, the importance of vaccinations generally, as well as safe practices during the pandemic rather, and also assisting with maternal and child resuscitation. And again, that's something else. I know there are Rotarians from this country very involved with that in Pakistan. Michael Fernando is very involved with that. So the environment, that's our new area of focus from the 1st of July. Well, this picture here, again, a personal story. This is a particular slum that we visited with a group of Rotarians. They had never visited this particular slum. Now, yes, it was a slum, but I have to tell you what they had done, all the community in that slum, they had created their own recycling facilities. Now, they had done it because they needed to earn some money to actually be able to feed themselves. But as an entire community, and then it was a community of several thousand people, they had sorted out different areas for the recycling environment. And as a direct result of that, a Rotarian from that community actually used them to establish recycling facilities across the city. And this is just an example of the plastic bottle top brigade that is happening in Rotary Great Britain and Ireland. You know, the environment is linked to it as well. It's all the extra things that we are doing to get rid of polio and to contribute to making the world a better place. Judith has mentioned some examples in relation to COVID. Going on to the polioeradication.org website, which is the one for the Global Polio Eradication Initiative, there's lots of stories on there, like I've mentioned about Hera earlier. There's also a publication, a recent publication, this one here, which is giving you examples of how the polio network has contributed to the COVID response. It is fairly lengthy. It's over 20 pages long, but it's really readable. It's not heavy type. There's lots of stories. There's lots of pictures. A really inspiring read when you start to want to talk to other people. You know, how do I talk about this? What can I say? Give me some ideas. Give me some stories. A great way to go. Another website that is really good and has got lots of relevant stories is africakicksoutwildpolio.com. It's a website that was developed for when Africa was declared wild polio free, the African WHO region, but it's got some fantastic resources on there. And this is just one of the pages that I was able to find earlier, which is under the legacy section, because we are leaving a legacy. The PolioPlus campaign is so much more than polio. And there's a section there about 7 ways the programme has benefited Africa as a continent. So another way of finding some of those stories. We are going to move to questions, and I will come back to this in a second, but just so that you're aware, our next polio seminar is on Tuesday, the 13th of April, not at 7 p.m. to 7 p.m. It's at 7 p.m. to 8 p.m. And we're going to be joined again by Dr. Zubair Wadood. You may have heard him speak back in July last year from the WHO. He's from Pakistan, but he's worked in Pakistan and Afghanistan. Absolutely brilliant speaker. He's going to be answering all the questions that we have in relation to circulating vaccine-derived polio. So keep that date in your diaries. So I'm going to stop sharing there from now. I'm going to turn to questions in a second, but please remember, PolioPlus is not just about polio. It never has been, it never will be. We are leaving the world in a better place because of every single penny that we contribute. And none of this is possible without us continuing to fundraise and continuing with our advocacy efforts. So I'm going to stop it there, and I'm going to turn to some questions. I've only had a couple in from the chat box. The first one that I'd like to put to you, Judith, please, is from Peter Berry, who's a DG in 1070. When he was in India 5 years ago, we were told that in the next year, we were moving to a dead vaccine that would cure vaccine-led cases. This doesn't appear to have happened. Why not? Now, I will also use that question, Peter, for the session in April. But Judith, is there something that you could tell us about the novel vaccine, etc., please?
Yes, there is a new novel OPV, which has been under research for the last 10 years in the Netherlands, funded by the Gates Foundation. And this week, it went through emergency regulation certification in November. And this week, it's being rolled out to 16 countries in Africa. They've started, I think, in Ghana and Nigeria, but they're not publicizing the rollout because they want to make sure that it all goes well. And once they've completed the vaccinations, the introduction of this novel vaccine in country, after 2 or 3 weeks, there will be some announcements about it. But it is happening. And I'm very optimistic that we are going to see a reduction in the cases of circulating vaccine-derived polio, because that's what this vaccine is being developed to address.
Thanks very much. And if any of you have got any other questions directly relating to the vaccine-derived polio, please email them to me so that we've got Zubair keyed up to make sure that we answer the questions that he wants to do. Margaret, James Cooper has asked, the chemically treated nets distributed alongside the polio immunisation campaign, does the fund for the nets come out of the PolioPlus fund?
Yes, it would have done. And also for COVID, in the last year, UNICEF and WHO have used $104 million of polio resources, polio funding, to respond to COVID. And they monitor what is being spent, and there's discussions within the GB&I of how we're going to get that back into the program. So yes, a lot of these things do come out of the polio funding, because without them, we won't have success anyway.
Thank you, Judith. Can you just explain how a little bit more about the PolioPlus committee, your grants committee, and how the decisions are made about how our money is spent? Because I don't think many Rotarians actually realise it is Rotarians, it is the PolioPlus committee and grants team that are making the decisions on how our 150 million is being spent. That's our 50 plus the 100 from Gates. But do remember, for every pound we get, it's worth 2. But for every pound we do not raise, we are losing 2. So it really is important to keep up that fundraising. So Judith, please, could you tell us a little bit more about the PolioPlus committee?
Yes, the International PolioPlus committee has a subcommittee which looks at the grants, and we meet 3 times a year. I've been chairing it this last year, and we review the grant proposals that are coming in from WHO and UNICEF. And in January, for example, we had grant proposals totaling just over $56 million. And obviously we only have $50 million each meeting, round about 50 million. Sometimes we might get 52 million, then the next time there'll be 48 million. But at the end of the year, we have to have the round figure of 150 million. And I can tell you that every time we have the grant proposals in, they're always in excess of 50 million. And so the need is huge. And they've already been through the national polio committees. So if there are grants coming in for Nigeria, the National Polio Committee in Nigeria will have reviewed these grants, and there will have already been discussions about them by the time they get to us. And then we go through them all, and we obviously have to prioritize. And this is based, sometimes the proposal might come in for, say, 2 rounds of national immunization days, say in Pakistan, say in January and May or June. And so if we haven't got enough money, if we're trying to save some money for this round, we'll give the money for the first round of the immunization days. And then by the time the second round comes round, we will have had another meeting. So it's about prioritizing and timing, really. But it is extraordinary what the grants are spent on. I think a lot of Rotarians are under the misapprehension that we buy the vaccines. Well, we are actually paying for the novel, the new NOPV to deal with the circulating vaccine variant. But generally, our money is going on actual staff members, transport, the cold chain, a whole variety of different things. And so we review all these grants, and we come up, we agree, and we go back and forth quite a bit. And once a year, we have a very detailed 2-day meeting with WHO and UNICEF separately to go through to help with the accountability of it all, and to get a better understanding of what the grants are being used on and why they need the money. So it is very carefully vetted. We then make the recommendation to the International PolioPlus Committee. I do that as the chair. And then our partners are there from the Gates Foundation, from UNICEF, from WHO, and from CDC. They're in on these meetings. And then we have a very robust discussion about them. And the International PolioPlus Committee then votes on these proposals. And when we agree with the proposals, they then go on to the trustees meeting of the Rotary Foundation. And it's the trustees of the Rotary Foundation that actually sign them off. And when they do, they always issue a press release, which gives the details of all the grants in that grant round. And that's on the RI website, if you're interested to see that.
Thank you. I think that's really important to recognise that it's Rotarians that are making the decisions about where the money that is raised by Rotary is actually going to go. Obviously, there's a lot of experience in making those decisions, and those requests are coming from the people that are actually going to be doing the implementation, but it really is important. You know, this is about Rotary. It's not that we're just giving the money away to someone else to do what they choose to do with it. And I know, for instance, Mike Webb, who has been a trustee of the Rotary Foundation for 4 years and is obviously a member, past president from Rotary Great Britain and Ireland. You know, he's been very involved in looking at the financial safeguarding and practices that go on to make sure that everything is being done in an appropriate way. We've got another question here from Eve Conway. How will our polio campaign help in the rollout of COVID vaccinations? Will polio workers be vaccinating against COVID at the same time?
There's a lot of discussion going on about this, but I don't think polio workers will be giving COVID vaccines. But obviously the discussions are ongoing. No, I think they're going to keep them separate.
Okay.
And
just on that,
the reason for that is, of course, that the polio vaccines are drops and the COVID are injected. Although yes, we are giving IPV that are injected as well.
Yeah, absolutely. And in fact, our speaker in April, Zubair, his role for the last year or so, well, less than a year now, has been focused on the whole work of polio immunizations, the COVID situation, and the situation with all other routine immunizations across the globe, because they are all connected to each other. You know, many countries, they have got healthcare systems because of the polio campaign. And the importance of that, you know, the cold chains, actually being able to get a vaccine from the point of manufacture to the mouth or the arm of a child, a huge contribution to the globe has been made in the expertise and the knowledge because of the polio campaign. And, you know, the laboratory network that Judith mentioned, I'm sure you've been hearing in relation to COVID, the fact that they're going to potentially be monitoring the sewage. You know, that's something that the expertise has been developed through the polio program, and that amazing network of laboratories for that surveillance established as part of the polio program. So everywhere you look, the PolioPlus program is making, has made, and will be making an enormous contribution. So those are the questions that I've got in. I would like to just again mention, please, the date for the next meeting. I'll put the screen back up so that you are not going to forget it. It is the Tuesday, the 13th of April, 7 p.m. to 8 p.m. I should have not said anything and see who actually spotted my error on that one. So that's with Dr. Zubair Wadood. The registration details will follow. The recording from this evening will be made available on the Great Britain and Ireland YouTube channel at some time next week. And I will also email you the link for that and email you the presentations from this evening. The rest of the polio team, so the core polio team in Great Britain and Ireland are Judith and myself, Eve, who's on the Countdown Campaign Committee, and then Keith Paver and Derek Rothwell, who are the regional coordinators. We're all available at any time to help in any way that we can, whether it's a one-to-one question, whether it's a talk to your club or group of clubs, whether it's a talk to people outside of Rotary, because, you know, let's not just be talking to each other, let's be talking to the wider public. And that's why I'm suggesting, you know, be talking to the people when you're volunteering for the COVID vaccines, when you're actually meeting online on a social with your local wine club or whatever. We are very happy to talk to other organisations as well. And I hope you would be as well. At this time, many organisations are meeting online just like we are. Let's use the opportunity that we are provided with. Yes, we are going to be going back to face-to-face at some point soon, we hope, But let's hope that there's going to be the continued opportunity for online meetings so that we can get in good quality speakers, so that we can share ideas, share expertise. So all of us are happy to be with you and help in any way we can. Derek is new to the role, and he is great as a resource. He'll find out answers to questions, etc. But he's a speaker in training, is something, a way he described himself to me the other day. But the other four of us, we all talk in different ways. We've all got areas of expertise. We've all got different passions relating to polio, but we're here to support you, to help you to keep that fundraising, that awareness going, and keep talking to other people. Use the trust that we've got, use the power of your voice, and please, please keep up the efforts. Thank you so much for everything that you have already done and for everything that you are going to continue to do, because it is only by all of us working together that we are going to be able to get to that final celebration when we have a world free of polio. And I'm not limiting that to wild polio or vaccine-derived polio. I'm saying when it becomes free of polio. So we're going to be finishing 5 minutes early, unless anybody's got anything else they want to put in chat. But I'd very much hope that you're going to join us again in April, and go out there, have some fun, enjoy Easter. Perhaps instead of buying some Easter eggs, you might want to make a donation to polio or do a fun online event. So please get involved, get in touch, share your ideas, share your expertise, share your experience. So thank you very much. Good night from us both.